Good morning. Go ahead and call the January meeting of the Emergency Medical Care Committee to order. As a reminder in this room, if you're going to speak, you do need to use a microphone. Press the button until it's green. If you're not going to be speaking, you can shut it off and the ring will turn red. Without the microphones, people on Zoom are unable to hear us. Should we start with introductions?
Yes.
I'll start.
I'll just do a roll call for
roll call,
EMCC and then
okay.
we'll introduce everybody who's left. Okay, so Will Hiller. Alternate Mike Esslinger.
Oh.
Back there. So no Will, you're
Yeah.
welcome to on the table.
Just listening online. I'm sick at home today. My apologies.
That's fine. Sam Klemick.
Present and accounted for.
We've lost our previous BLS person to retirement. We acknowledged last time, I believe. So Cheryl Getz. Thank you. Harry Robbins. Jody Schaefer. Paul Wood. Here. Dr. Lutz. Spencer Harnett. Carla Spencer. Chris Workin. John Anthony.
Here.
We have a quorum of members. I'll just go quickly through ex officio members. Kelsey Scanlon. Teresa Rios. I've got you, Teresa. Leah Magoski. Perfect. All right. Any alternates that I did not call? Mike DeLeo, thank you. Any others? All right, guests. We'll start with the room.
Silas Fisher, Monterey Fire.
Justin Reyes, Monterey County Regional Fire.
Bill Stewart, South Florida. And Hitchcock Amos, CES.
Good morning, Baridale Mashai, CEO Healthcare Services at Correctional Training Facility in Soledad.
Oh, great to have you. Thank you. Thank you, Shane. Let's see. So anyone else online who would like to introduce themselves?
Morning, this is Joe Cafaro with the Hospital Council.
Oh, thank you, Joe. Anyone else?
Hello, Matt Bogenson. I'm the city manager of Pacific Grove and just logging in. And I think I don't see a camera feature, but nice to see you.
Great. Thank you for coming and joining us. Anyone else online would like to announce their presence? All right, EMS agency staff. Over here.
Good morning, Blake Anderson with the EMS Agency.
Good morning, Deborah Hopgood with the EMS Agency.
Kimberly Hernandez, EMS Agency. Karina Moreno, EMS Agency.
And Steve Brooks, EMS Agency. Thank you. Appreciate it all being here.
All right, item 2 on the agenda is public comment. Any member of the public may address the committee for a period not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications but not take any action. Any public comment? Seeing none, no hands raised. Move on to the approval of the past EMCC meeting minutes.
With approval of the October 13th, 2024 meeting minutes.
I have a motion from Harry. A second? Second by Jody Schaefer. All in favor, say aye. All opposed? Motion's carried. Okay, item 4, reports. EMS Director Teresa Rios.
Thank you. Happy New Year to everybody. To whom I had not wished a Happy New Year. My apologies for not being there in person. Some personal life events have prevented me from being able to be there today. I'm going to keep my report very brief. in previous meetings, we reported that we had experienced a backlog of unusual occurrence reports and had committed to clearing that backlog. I am happy to report that we have cleared the backlog. Most of our UOs are now less than 3 months old. We really appreciate your cooperation to provide us with information that we request. It really helps us to expedite our reviews. We also have reported the implementation of a new UO database that was created internally by our health IT department. And it is working now. There are a few kinks and staff are working on resolving those. We continue to attend the meetings with Salinas Valley State Prison. AMR is now included. We plan to do a presentation to their team at their February meeting, and hope to be able to schedule a meet and greet between Dr. Burley and Salinas Valley's medical doctor. We we wanted to wait a little longer. We were hoping to be able to do the presentation and the meet and greet at the same time. So hopefully in February we'll check that off our list. I do want to start just talking about goals that the EMS agency has for the year. For 2025, one of our goals is to bring QA training to EMS, and that's both EMS, the team internally at the EMS agency, but also roll out a system-wide QI training. I think we should be doing those periodically. There's staff turnover on in every agency, and just to make sure that we have a more consistent way of approaching our QI plans in particular, which go to the state. We have spoken to the QI team at the health department on this project, and we have also spoken to an outside consultant to begin the planning phases. So more to come. To me, it's an exciting project. I love QI and the work that we do together. As soon as we finish the HDE implementation and working on the major kinks that have been identified with HDE, the next big project that we want to tackle system-wide is addressing the data accuracy in ESO. Each time that we try to access reports, we identify deficiencies in the way that we are collecting, in the way that we are tracking, in the way that they are reported within ESO. So doing this work with our stakeholders, with the EMS agency, and definitely with our vendor ESO is going to be key. So we don't have a date as to when to start, because we have been kept pretty busy with other projects, including just ensuring that each HDE is fully implemented and working out the kinks. That's the extent of my report, and we'll be happy to answer any questions you may have.
Any questions for Teresa? All right, thank you, Teresa.
Thank you.
Next, Clinical Care Committee report from Dr. John Burley.
Thank you. So we just finished our CCC meeting and had a pretty good discussion regarding multiple things. One is HDE, which you'll get a report on at this committee a little bit later in the agenda. So I won't steal Blake's thunder on that. We also had a review of the 2025 policy protocol review cycle. Steve went through public comments, and we had a really good discussion on multiple items that were brought to the EMS agency through the public comment. We are looking at the March meeting of CCC for approval of the 2025 policy and protocol review cycle. There's a few tweaks that we want to make to the policy and protocol prior to that, but things are moving along well. Just as a 30,000-foot perspective, we had 70 policies, policy updates, 12 major revisions, 14 minor revisions, and 5 new policies that we brought this approval cycle. Looking to 2026 policy and protocol review cycle, we had some discussion regarding several items that we'll be considering incorporating into the next cycle. And so we look forward to that as well. We had received a notification that Monterey Fire Department application to provide ALS services, response services to the city of Pacific Grove was approved by the Board of Supervisors, and the EMS agency staff will be going out to the peninsula later this afternoon as required by the state to do our mandated inspections. We had received an update from Blake regarding the buprenorphine local optional scope, and we had been notified recently that the state will be extending some funds this year again for buprenorphine implementation and so forth. If you have any questions on that, please feel free to check in with Blake, who can provide you with further details. We also got an update on CQI tag. Those were the major things from today's CCC meeting. Happy to answer any questions.
Any questions? All right. Thank you, Dr. Burley. Next, Operations Working Group, Teresa Rios.
Sorry, I double muted myself. Ops has not met. We reported in a previous meeting that the EMS agency wants to take a look at the items that really should be going to Ops. A lot of the stuff comes directly to EMCC. So we need to do that. Other projects have kept us pretty busy. As soon as we close the loop on some of these projects, we'll do that work and report hopefully at the March EMCC. Thank you.
Thank you, Teresa. Next, Mohawk, Deborah.
Yeah, good morning, everybody. We are continuing to work with public health and other health department staff to monitor disease prevalence and illness prevalence throughout the county. Luckily, COVID numbers have started to see a bit of a decline, as well as RSV. Influenza numbers do remain very high, though, just for your kind of differential diagnosis and index of suspicion while you're out there seeing patients. Good information to have. We also recently attended the preseason flood coordination meeting hosted by the Department of Emergency Management in December, and would like to extend a thank you to Chief Vanderveen and Chief Klemek for inviting us out to their active attacker exercise that took place in December. That was great to go out and see that. Obviously, they put a ton of effort and time into the planning of that exercise, and it was an impressive exercise and went really well. So thanks again for that and for that effort to include us and other agencies throughout the county as well. Much appreciated. We are continuing to work with the Bay Area UASC and the planners on another active attacker full-scale exercise. The final planning meeting for that takes place in late January. We'll be participating in that, and then the eventual exercises when they take place late first quarter, early second quarter of the year. And then we're also working with emergency preparedness from the health department for a surge exercise that will be taking place, it looks like, in early April. So another planning meeting coming up for that this month as well. So those are the big efforts that are going on currently. I'm happy to answer any questions if there are any.
Any questions? Thank you, Deborah. Next, EMS system performance metrics, communication system 800 and ReadyNet. Amber?
Good morning. So the ReadyNet drills and the 800 megahertz system testing was included in your agenda packet. ReadyNet was pretty status quo we're reporting on October and November. However, for 800 megahertz, Me Memorial and Natividad were experiencing some issues with their 800 megahertz radios. So they were put in touch with the radio shop, and last I heard, those had been corrected. Me Memorial had to get a temporary radio, and I think they're working on getting a more permanent one. So that's why their percentages were lower. Everyone else pretty status quo. Can I go into the metrics?
Just roll right on through.
Just keep rolling. All right, so contract compliance, again, that's included in your agenda packet, PowerPoint. All reportable priorities met or exceeded 90% compliance with the exception of yellow priority 1 in October, which was at 89%. When we met with AMR to discuss contract compliance, they attributed that dip in compliance due to some delay in shoot times. They were addressing it. It seemed like it was isolated to a specific crew that worked in South County that were having some shoot delays. And then in November, the compliance percentage went up to 93%. For MPDS in October, 71% of the adjusted call volume was EMD'd and 4% was aborted with help arrived. So a total of 75% of all calls were EMD'd up until the point they could no longer be because someone arrived on scene to help. And for November, it was at 74%. Does anyone have any questions on contract compliance? Okay, thank you.
Fire-based ambulance report? I don't have a presenter on the
Yeah,
agenda.
that will come in March.
Come in March, okay. Okay, moving on to old business, the ambulance RFP. Teresa?
You're muted, Teresa.
You're muted. We can come back to that one. EMS ordinance revision. Deborah Hobgood, that's on hold. Health data exchange, Blake Anderson.
All right. Good morning, everyone. So in your packets, you should have received a report on the health data exchange implementation. We've been excited overall with, how much we've seen improvement. However, there's still a lot to keep working on. There have been some minor updates since this report was drafted, so I will give a little presentation on those. But as of right now, when we're looking at missing outcomes to provider agencies and the causes of that, the two primary reasons that we're finding that EPCRs are not connecting with hospital charts and creating a bidirectional data exchange. One being that certain agencies were not built properly into ESO to facilitate the HDE exchange. We have since addressed that with ESO and all the agencies that were affected. There is one that we have gotten in contact with that is still needs to get approval and the process, but we have chatted with them on a one-on-one, but everyone else right now is in the process of having their ESO accounts updated properly so that way they can receive outcome information. And the second being that Natividad has had some issues with registration, which has enabled or prevented outcomes from being transferred to the provider agencies. So we continue to work with Natividad on making sure that they're aware of the situation and that they can do the necessary change in education that they need for their registration team. Along with that, the current status of each hospital, Natividad is fully operational with HDE as well as CHOMP, which went live on October 18th. Me Memorial has been in the building phase and is now starting to transition over into the testing phase. And SVH has also been fully bidirectional with the essential elements, and that was starting on October 11th. And as an additional HDE update on December 17th, ESO representatives Chris Montero and Jennifer Wilson came to Monterey County to speak with us and our provider agencies about just ESO needs. And during that time, it was revealed to us by some of our provider agencies that for some reason, certain patient outcome reports were not fully being sent, whether they just get a demographic sheet, but there was no physician's notes to it, or there was no physician's notes either from the ED department or the admitting hospital staff. So we have gathered some examples of that to ESO. We have sent them the cases where this has been seen. And during our CCC meeting, it was addressed by one of the agencies that they're at about 50-50 rate, whereas they get a complete outcome report versus an incomplete outcome report. So we, again, we've connected with ESO, showed them highlights of these cases and have asked them to provide us a report on what's going on and how we need to fix that. In addition to, we've also identified cases where transporting agencies receive outcome reports, but for some reason the non-transporting agencies were not. So again, we've highlighted those cases, sent them over to ESO and have asked them to provide an explanation on what's going on. So we will hopefully have more to come on that. At this time, are there any other questions about the HDE project? Hearing none, thank you very much.
Blake? Ambulance RFP, Teresa, are you able to do it?
Yes, I'm sorry. The update remains the same. The RFP is still with the state. They sent us more questions. We answered them, and right now we are waiting. They are aware of our timeline, and so we are hoping that they will expedite the approval so we can release ASAP.
Thank you. Any questions regarding the ambulance RFP?
I do have a question.
Right.
I just want to confirm, I brought it up at the last EMCC meeting of what the contingency plan is. So correct me if I'm wrong, our existing contract with the OA provider expires July 1st or June 30th?
No, we have an amendment through January 31st of 2026. It's already been signed. It's been approved by the board.
All right. Thank you.
You're welcome.
Any other
Thank
questions?
you for asking.
Okay, EMS policy 3030, section 3. Steve?
This is left over at the request of Chief Klemick, related to EMT determination code being transmitted electronically to all fire agencies. And at this point, there's just no movement. So unless you have something further, this is just a placeholder as requested.
Okay, thank you.
Happy to do so.
South County response data, Kimberly Hernandez.
There's no report. I think that was an error on the agenda. Sorry about that. There's no report on the South County response data that was reported to the committee in September. And then we brought back pulling, because the city of Soledad, they wanted it separated with the prison and the city, which was brought back in November. I'm going to move into the next item, which is the prison impact. Our epidemiologist and our epidemiology intern are working on that. And we'll hope to have more of an update in March, but they are currently working on the prison impact responses. Any questions? Thank you.
EMCC appointments, reappointments. Steve?
All right, so this has just been an ongoing item on the agenda. However, I will point out that next month is when we're going to truly focus on the status of those whose appointments expire in the end of June. And so we'll be reaching out to you to continue the documentation, just, from your agency saying, yes, that you're representing, that yes, I'd like to have you continue, and then we can begin moving through the process of reappointment. So we'll be starting the reappointment process next month, just so you're aware. I did not bring that today, but it'll definitely be here for next March.
Thank you, Steve. And no new business for today. Are there any announcements for the good of the order? Any member of the committee may make announcements or comments. The EMCC may not discuss or take action on any item raised during the announcements except to decide whether to place the matter on a subsequent agenda. Jody Schaefer.
You've been working on this 20 years?
Thank you, Jody. Any other announcements for the good of the order? Seeing none, our next meeting will be March 12th, 2025 at 10:30, and it'll be in this room,
Yes.
at 10:30. Thank you, everyone, and the meeting's adjourned.
Thank you all.